Public health officials in the United States have been saying consistently from the start of the coronavirus outbreak that masks are not recommended for the general public.
But yesterday, President Trump raised the possibility that mask use might be considered for the general public. Dr. Frank McGeorge here to help us clear up what confusion there might be. And there have been so many questions about masks and their effectiveness since this started, Doc.
Indeed, Sandra and Devin. So let me start out with a very clear message that cannot be misunderstood. The first priority for any personal protective equipment, including masks, should be healthcare providers and anyone associated with the care of infected individuals. Now, that said, especially in communities with high levels of spread, mask use might make sense, but with some caveats.
We'll take a look at it for a period of time, not forever. I mean, we want our country back. We're not going to be wearing masks forever, but it could be for a short period of time.
That was President Trump yesterday responding to a question about whether mask use in public might be a possibility. Although the CDC and World Health Organization have stated that mask use by people who are healthy and not in a healthcare role is unnecessary, there are many countries like South Korea and Japan where it's encouraged, and many European nations are reconsidering or changing their stance on mask use. Scientifically, recent studies published in the New England Journal of Medicine and the Journal of the American Medical Association taken together suggest microscopic aerosol particles that are expelled by a cough or sneeze could remain infectious and linger in the air for an extended time or travel a further distance than the 6 feet of separation that we've recommended. Clearly, in a time of mask shortages, priority needs to be given to those on the front line of patient care. Additionally, mask use is recommended to help infected individuals keep their coughs and sneezes covered and prevent spread. Here's the thing, though. Now that we're in a time of widespread community transmission, and we should assume anyone might be infected, it makes good sense that everyone should wear a mask for everyone's mutual protection. But until there are enough masks for healthcare workers, the general public should consider homemade masks. So here's a really important point. The potential downsides to mask use are really important to emphasize. First, they might provide a false sense of security. Mask or not, social distancing and especially hand hygiene remains absolutely critical. Also, if you do use a mask, please be sure to clean your hands before you touch it, adjust it, or when putting it on or removing it. Touching your face, even when you have a mask on, is still a source of serious and important contamination.
And Doc, I know that you've supported the CDC's mask position in the past. Is this a change?
Well, not really. I've always felt that the CDC stance strongly against masks for the public was a little bit extreme, but it was justifiable looking at it from a risk-benefit standpoint. There are potential downsides to masks, which I just discussed. That would be the risk. And before, we frankly lived in a lower transmission risk environment, which would make it a limited benefit. But now things are completely different. There is widespread community transmission, so the risk to benefit ratio in using a mask in public has shifted in my mind in favor of using masks.
Interesting. And we will continue to keep taking your questions to Dr. Frank McGeorge. Thanks so much, Doc. We'll talk to you soon.